I was in excruciating pain that I had never experienced in my entire life. I could hardly walk. The pain was so bad that my brain wouldn't let my body fall asleep. So I was maybe catching 15 minutes to 30 minutes of sleep an entire night for 2 weeks. I knew I had to do something, and I was concerned if I went to a traditional MD, I might go. I didn't want to do surgery. I thought this is something really serious, and so I want to see it. This is back pain. This spells chiropractor.
Hello and welcome. My name is Dr. Brendan Bradley. I'm a chiropractor that has been practicing in Bakersfield for the past 20 years. And what I want to talk to you about today is a unique treatment that we offer here called non-surgical spinal decompression. And we use the DRX 9000 to provide that treatment. We have been offering this particular treatment for over 10 years now, and we're here to talk about some of the conditions that can be helped with this type of therapy. So let's talk about what a disc is, what a normal disc looks like, what a herniated disc looks like, and what types of disc problems we can help and what types of disc problems we can't. So a normal disc is like a jelly donut, all right? The center is this gelatinous material called the nucleus pulposus, and then the outer portion of the disc is called the annular fibrosus, and this is a very strong network of fibers that allow strength and flexibility, and they also keep this jelly contained in the middle. Now, when a disc herniates or bulges, these fibers have weakened or they have torn, and it allows this jelly material called the nucleus pulposus to push backwards. So this is a healthy segment. When a disc is not bulging, it is not extending into this hole where this nerve is exiting. Now I'm going to show you a herniated disc. If we look at one from the top here, this would be the back, this would be the front, and you can see this red structure. That's a herniated or bulging disc. When those happen, they will, let me grab a different model here, they will enter into this area where the nerve is exiting off your spinal cord. And when that disc bulge is pushing on that nerve, it's a very painful experience. And people have severe leg pain when this is occurring. They have severe muscle spasms. They, in many instances, can hardly move.
And then by the time I drove home, I couldn't even walk. I got out of the truck, I couldn't walk. So I was in pretty bad shape. Excruciating pain. I never, that's the worst it ever hurt.
Right.
I mean, I was down, and I was at home, I couldn't sleep. I was laying over a ottoman we had, and that was the only way I could get any kind of relief. I couldn't even go to the bathroom. I couldn't even hardly sit on the toilet long enough. It hurt.
So how does spinal decompression treat this? Well, it's a specialized table that we put you on, and we use a harnessing system that isolates this area. It's a very comfortable machine. We are able to set you up. We start in a standing position, and then we lay you down. You're now in a horizontal position, and we do a very comfortable distraction at this level. We basically are pulling these two areas apart from one another. That creates a negative pressure in the disc and pulls that bulge back into the center of the disc. A lot of people want to know if they can do that when they're in a lot of pain. They're afraid because they can hardly move. Most people who get on this table get relief right away. In fact, the majority of the patients that we've treated, within the first 3 visits, they are significantly in less pain. And typically by the second week, they're 50% or greater better, or their situation, their pain is at least decreased.
And it wasn't until the 3rd week where I started to feel some relief. I felt like I was getting better. Then I began sleeping more.
Right.
And the healing process seemed like it was occurring faster. The numbness and tingling have almost gone away completely. In fact, today, over the weekend and today, this week, I really haven't felt any tingling, numbness, very little itching.
The other conditions we can treat are things like degenerative discs. These discs are very fluid-filled structures, and they can lose a lot of that fluid in height. This is an example of a degenerative disc. It has lost its height. I like to use the analogy of a kitchen sponge. If you keep movement around a sponge and use it, and it gets in the water faucet every day, it stays nice and thick and it stays flexible. Your spine's the same way. Your spine needs to stay flexible and needs to have movement occurring around these discs to keep them thick and full of water and healthy. If we squeeze all the water out of that kitchen sponge and we set it on the windowsill, it loses the height, it shrinks down, and it gets hard and it gets brittle. Well, degenerative discs are very similar to that. We can also effectively treat these using the DRX 9000. By creating that negative pressure once again, we are able to draw water and rehydrate that disc and help it thicken up. The third condition that is really common for us to treat is what we call facet syndrome. Back here in these posterior structures, you have two joints, and this is where movement occurs in our spine. When you have less spacing between the vertebrae because that disc has lost its height, those joints are now under more pressure, and it is painful as well. So when you have a degenerative disc and you can create a decompressive force around it, you help rehydrate that disc and get some thickness back in there, allowing more space and less pressure on the facet joints as well. So just to recap, 3 common things that we very effectively treat are bulging or herniated discs, degenerative discs, facet syndrome, sciatica. Those are the things that people have heard about if they've been in these situations, and these are the kind of things that can help. The table is very comfortable. It lasts about half an hour. Most people, especially if they're in pain, they're actually pretty relaxed when they're on the table because it's the first time they've had a significant decrease in their pain in some time. In fact, many people when they get on the table fall asleep because they haven't been sleeping well, they've been in a lot of pain, and now they're finally doing something that is taking away some of that pain.
But then once I got on the machine, the decompression table, I guess, and then that really seemed to help. It was a little hard to breathe because the straps are tight.
Yeah.
But it did relieve the pain like that, and then when I got off, I'd feel better. I mean, every day, I was looking forward to trying to get on this thing. When I usually left your office, I would
Right.
feel better.
If you'd like to find out if we can help you, please call my office and come in for a free examination and consultation. I will take a complete look at your case. If you have an MRI, if you have x-rays, bring them with you. We'll look at them. I will show you the table. I will explain everything to you. And if I can help you, I will come up with a treatment plan and a way for this to happen for you. If I can't help you, if you have a condition that is just beyond what I can do and I think you need to see a specialist, I will set you up with one. That's my promise to you. So, like I said, if you want to find out if this treatment can help you, call our office and we'll give you a free consultation. Thank you so much. Bye-bye.
Yeah. So now I'm back to normal, but I feel right now I feel good. I have a little numbness in my left leg on the shin, between the knee and the, but it even seems to be getting better right now. I can drive. We're doing our room. I'm painting. When I go home today, I'm going to paint above my head, and when you have a back problem, it's hard to reach above your head.
Sure.
But right now I feel good enough where I should be able to do that.
The difference between today and the first day I walked in here is just beyond belief, and my mind has been able to put that pain away to a point where I don't even remember it, and I don't ever want to experience that again. I know that it was really bad, but when you're not experiencing the pain, you really can't relate to it. But looking back now, I mean, it was worth every penny of it. It's, there's nothing more important than your own health, and I appreciate it, and I hope I don't have to see you again.
Thank you.